Hello, my name is Christopher Henson. I'm an animal science major at Tarleton State University, and this is my ANSC 4300 social media video project. My project is over cattle receiving protocols and initial management for stocker and feedlot cattle. When receiving cattle, it's important that you divide them into two groups based on their level of health risk, high risk and low risk. This is going to greatly affect how you handle their initial management as well as the treatment and labor allocation. When you want to classify your cattle into high and low risk, there are multiple factors you need to consider. First being their average weight. If their average weight is calves are less than 500 pounds, then they are considered high risk. If they are above that, they are considered low risk. When you consider your animal's history, whether or not they were preconditioned, trained on a bunk and trough, vaccinated, castrated, dehorned, if they aren't any of those, then they are considered high risk. You also need to consider how long they've been transported. Animals that have been transported for extended periods of time are stressed out and at higher risk of obtaining diseases. They should also be given 1 hour of rest for every hour of transport. They are considered high risk if they've been transported for more than 12 hours without rest. Next is the source of your cattle. Cattle that are from a trusted source are considered low risk, but if they are from an untrusted source, such as an auction barn, then they are considered high risk cattle. The next thing you need to consider when receiving cattle is cattle receiving pens. Receiving pens should be relatively clean, as in having no feces or other refuse around that will make your cattle sick. They should also provide access to water ad libitum, which means free access. Should also provide feed, such as a milled ration or a high quality hay. Your pen should also provide shelter to your animals. Provide them shelter from heat, cold, extreme weather conditions. This is needed because extreme weather conditions can stress out your cattle and reduce their risk of getting diseases. Next is vaccinations. Vaccinations are important for every operation as they decrease the risk of disease that would otherwise decrease the productivity of your animals. It is important that all injectable vaccinations are given in this area in front of the shoulder and the neck. This is because there are very little valuable cuts in the area. Vaccinations will still ultimately depend on what your operation needs and what is recommended by your veterinarian. There are multiple kinds of vaccinations, such as modified live vaccines, killed vaccines, and chemically altered vaccines. The most effective one is modified live vaccines, though they need to be mixed and then used in short order. Some common vaccinations given to cattle are 4-way respiratory vaccines, 7 or 8-way clostridial vaccines, and metaphylaxis. Metaphylaxis is a preventative used in high-risk cattle, most likely for bovine respiratory disease. It is a fast-acting vaccine that will need to be followed up with a longer-lasting vaccine. Another important thing is record keeping. It's important that every operation has proper records, such as a vaccine log. Vaccine log should include multiple things, such as the lot number of the vaccine, the number of head in the pen number, the vaccine given, as well as the expiration date, the withdrawal date, and the date given. When dehorning your cattle, there are 3 primary methods that are used. First is banding. This is when a high-tension elastic band is placed around the base of the horn of your animal. This will remove it over time by causing it to lose blood supply. This is not recommended though, as it is associated with a lower average daily gain over a longer period as compared to the other methods. Next is mechanical removal. This is when either surgical method or a scoop dehorner is used to remove the horn. Next is tipping. Tipping is not associated with any decreased average daily gain, as only the tip of the horn is removed where there is no blood supply. It is not painful for the animals, unlike the other 2 methods. Up next is castration. Castration uses 2 primary methods in most operations. First is bloodless. Bloodless castration uses an elastrator to cut off blood supply to the testicles so they slough off over time. This is usually only used in young bulls, as it is associated with more complications in older animals. The next method is surgical. This is usable in all ages of animals, although it is still associated with more risk in older animals. It is also more expensive than banding. Another important form of preventative used in cattle operations is dewormer. Dewormer is used to prevent the growth of parasites in your animals. There are two primary forms of dewormer, pour-on and injectable. Pour-on dewormer is cheap and fast and doesn't require much handling of your animals, although it will need to be timed with the weather events so it doesn't wash off with rain. It is also not long-lasting, so it will need to be used more than twice per year, most likely. Next is injectable. Injectable is a longer-lasting option, despite being more expensive. It also requires you to handle your animals more, such as restraining them in squeeze chutes so that you can get the injection in their neck. It is not recommended for larger operations and less feasible. Lastly are cattle implants. Implants are a cheap and effective way to increase the average daily gain of your animals by up to 20%. There are three primary kinds of implants used in cattle: androgenic, which is a testosterone-based implant; estrogenic, which is estrogen-based; and combination, which is a combination of the two. Of the three, combination is most effective, while estrogenic is least effective. All of them ultimately serve the same goal, which is to increase the average daily gain of your animals by increasing muscle growth and bone growth. Some implants will decrease fat deposition depending on the rate of growth of your animal. If your animal grows slow, fat deposition will decrease. All implants are given in the same place in stocker and feedlot cattle, which is in the middle of the ear in between the cartilage and skin layer. Thank you for watching my presentation. I hope you enjoyed. Have a good day.